welcome to The Extra Mile. I'm Linda Boudreaux. Our guest today is Dr. Scott Broussard. He is a veterinarian and the owner of the Waggin Train. I want to say Waggin Tail, but you know where that comes from.
Yes, ma'am.
And we're going to be talking about veterinary medicine and what we need to know to take the best care we can of our dogs and cats and other small pets. So welcome, Scott. Thank you for coming.
Thank you very much. Thanks for having me.
I guess you are a small animal veterinarian, right?
Yes,
so you do work primarily, I guess, with our pets, the ones that we have in our houses, is that, or around our houses, is that fair to say?
Yes, ma'am. I would say probably 99% of what I do is small animal medicine, so meaning dogs and cats exclusively.
Okay.
Every once in a while we'll see an exotic like a rabbit or a ferret or something.
I was going to ask, what about those that not so many people have, guinea pigs?
I see them rarely. I don't see them often. The simple reason I don't think I know they're not nearly as popular, of course, as dogs and cats are. The other thing is I think a lot of veterinarians in town kind of have an established reputation that they handle exotics, so they tend to get a lot more of the calls as well. They just kind of funnel into those practices specifically. But I see a few, specifically birds, like large birds. A couple years ago, I got into falconry, where I have a hawk, and I have.
You personally got into it.
I do. So that far from makes me an expert, but I do have a little bit more experience and comfort working with some of the larger birds of prey like that. So I do see some of those from time to time.
I didn't even think about people bringing their large birds of prey in, but I guess whatever.
It's so rare. Most of the ones that do are just falconer friends of mine, you know, that know that this is what I do, and if they need help or a bird gets injured or something, then they'll bring it into me. But,
but for most of us,
most of you dogs and cats. Like I said, 99% is dogs and cats.
Okay, so I guess the most basic question is, what does a pet owner need to know to keep their dog or cat at optimal health? What are some basic rules, to-dos?
Well, it's a lot. I think probably the single most important thing as a puppy, as a young dog, is to begin with vaccinations. You want to make sure that those puppies starting at about 6 or 7 weeks of age are vaccinated properly with everything from parvo, distemper, rabies when they're old enough, bordetella, sometimes known as kennel cough. Those type of vaccines are very, very important to start off as a young dog. They have to get that basic immunity built up. So that's very, very important when they're young. Also, heartworm medication is something that is paramount. A lot of times people call and they ask us, well, when do we start heartworm preventative? Typically 6 weeks at the first visit.
When you're real little.
Absolutely, because some people will come and say, well, I didn't think you had to start until 6 months or even a year. I've had a few people say a year of age. The fact is, heartworm disease is spread by mosquitoes, and any dog from 6 weeks to 6 years or any age in between can easily get bit by a mosquito, and we all know the problem we have with them here in this area. So it's imperative that you start early and keep them on it, depending on the product you choose, but keep them on it every month without fail, basically for the duration of that pet's life.
Okay, so heartworm treatment and vaccines for little ones. Do we continue to vaccinate? Because, you know, there's been some discussion about, or some talk about whether or not we need to really vaccinate our dogs every single year. And
it's a valid point. I think what the question that a lot of veterinarians still even struggle with is how long does the immunity from each of these different vaccines last? One of the problems that we experience is the vaccines come, you very rarely are going to get a vaccine just for parvo or just for distemper. They're going to come in a group. The one that I use right now, again, a large percentage of the time, honestly has 9 different components in it. And some people kind of shy away when they hear that. But
isn't that a lot for your pet to take in at one time?
You would think it could be. The reality is that it's very, very rarely do I see an animal experience an adverse reaction to a vaccine.
Really?
I can't sit here and say it never happens. That's not true. But rarely. As I sit here right now, I would honestly tell you that it has been probably 6 months or more since I've had an animal, and who knows how many thousands of pets that is, that I've vaccinated. And maybe one in the last 6 months has had an adverse reaction where we had to give something like Benadryl or a steroid or something like that to subside the reaction.
So how long do we have to have or how often do we have to have our dogs and cats vaccinated?
Okay. Rule of thumb is still basically on an annual basis, okay? It's still what I recommend as a veterinarian. It's still what I do with my own pets. And basically in my practice, we still booster vaccinations once a year, and that goes for a dog or a cat. Reasons being, number one, rabies vaccine. Almost everybody is familiar with what rabies is and how important that is. The city of Lafayette does actually have ordinances that say that every animal above the age of 3 months has to have a rabies vaccine, and that vaccine has to be boosted annually.
So that is the law here.
That is the law here, yes ma'am, yes ma'am. And it doesn't matter if your dog or cat is indoors or outdoors, or if they had it in the past or not. If they've not had it within the last 12 months, then you and they are in violation of the law. Again, I know it's hard, and probably very few people have been checked by animal control, but if they ever come and they say, hey, can you provide proof of vaccination, and you cannot, then they'll kindly hand you a ticket for violation of the law, and your dog will be forced, or cat will be forced to get that vaccination. And it's a good thing. Of course, rabies is a human threat. It's not something to be taken lightly. It's also
Do you see much of it? I mean,
I don't.
we don't hear about that very much anymore, probably because we vaccinate our animals.
True,
but.
true. The vaccine is very, very effective, and that's a good point, because rabies, probably long before I was a veterinarian, and probably even before I was born, was much more of a problem when the vaccine wasn't as readily available. But no, in recent years, the disease is pretty well under control. But to answer your question, do we still see it? Very rarely.
Okay.
I've been in practice for almost 15 years. I think I've seen 2 or possibly 3, I might be forgetting one, but 2 or 3 documented cases where the animal either passed away or had to be euthanized, and we tested after the fact, and it was confirmed to be positive for rabies. So it's not overly common.
But it's there.
But it's
Let me
there.
ask you, like people can be treated for rabies. Can our pets be treated for rabies too, or is it just kind of,
I tell you what, even when you say people can be treated for
it's
rabies,
a tough treatment.
yeah.
It's a tough treatment.
There is a protocol, and I'm not a human physician, so I don't know all the ins and outs of it, but I know that if there's even a chance that a human is bitten by a rabid animal, then they start the whole rabies treatment protocol on those guys.
Right.
So, and that's what you're referring to, I'm sure. If that action is not taken soon, right after the bite, there's really not much more you can do for a human than you could for a person, for a dog, for that matter. Yeah.
So there's really not a lot that can be done.
No, and seeing the hard part with animals is they fight all the time. They bite all the time. They get in a scuffle with a wild animal often.
And they can't tell you that
they can't tell you. So you don't know always that even that they were attacked or bitten by something. So a lot of that's the problem of rabies, and that's why the law says what it says, that they have to be vaccinated. It's just not worth the human threat to even take a chance of being exposed to a rabid animal. But that's one, and that's probably the most important vaccine, again, is rabies. Other things are like the combination vaccine. A lot of people call it a 7-in-1 or an 8-in-1 vaccine, and for good reason, because they do have multiple components in one. I guess I don't want to bore you to tears with all the individual ingredients, but the most common that people are aware of are parvo and distemper.
Okay.
That's the 2 most common viruses that people have heard of. God forbid, many people have been even, had pets that have been affected by those, unfortunately. Those are very real. Those are still out there. When I say those viruses are still out there. They're still very real. It's still very important to vaccinate those dogs and our puppies for those particular viral agents.
Even like animals that are in the house all the time, I mean, are they likely to come in contact with those viruses?
It's difficult. I'll go back briefly to the fact that the vaccines are often lumped together. And why do we do it? Because who wants to get stuck 9 times with a needle?
Not
to be
even
vaccinated?
my puppy does.
Exactly. So you'll have distemper, parvo, hepatitis. There's 4 different strains of something called leptospirosis that at least maybe not everybody uses the 4-strain vaccine, but it is fairly common. Exactly. So there's a lot of different components within each vaccine. To answer your question, is it necessary to do them as often as we do, or yearly? Some of those vaccines, specifically parvo, distemper, and I think coronavirus, again, I'm not an immunologist, so I might be missing a couple, but it has been fairly well documented that the immunity from some of those vaccines will extend well beyond a year. In fact, probably closer to 2 to 3 years in some cases, Some states, some veterinarians for that matter, have adopted a system where they'll vaccinate for those core vaccines every 3rd year, for that very reason. The only reason I have not adopted it is the one that I use also contains leptospirosis. Leptospirosis is a bacterial disease that dogs or cats can get from rodents. It is spread through the urine of rodents. I know it sounds yucky, but it happens.
And it's part, I mean, we do live with rodents.
Absolutely. With all the sugarcane fields and other, agricultural fields, mice are very common. So outside dog, they don't eat everything. Maybe a mouse goes, helps them finish their meal, and who knows what happens. It's not a rampant disease, but the scary part about leptospirosis, it's one of the very few that we can catch from our pets. It does not discriminate from dog to cat to any other species. It can cross species, and it's bad. It can cause oftentimes multiple organ failure at the same time, specifically the liver and the kidneys. but that's two pretty important organ systems that
you don't want to. You don't want to be messing with that.
I'll tell you from a veterinary perspective that when I've treated patients with it, it's a very small handful that can live to talk about it in weeks to come. So it's a bad disease that I wouldn't wish upon anybody, because that the immunity that is produced by an annual vaccination, it barely lasts a year. It may not, in some cases, last an entire year. And for that reason, and that reason primarily, is why I still vaccinate annually. To me, it's not worth the risk.
Okay.
I know in recent years there's been a lot of buzz with, even in humans, with talk of vaccines possibly causing autism and things, those kind of things. We don't have that kind of an issue in veterinary medicine. And as I said at the outset, I can't really ever think of a case that I've seen a client's animal truly affected by over-vaccination. To me, the benefits just far outweigh the potential risks from the vaccines.
So go ahead and vaccinate your dogs and your cats every year, even if your dog and cat stay inside.
I would.
For your safety as well as for your animals'
Absolutely.
safety.
The old expression, cheap insurance, which I use a lot, it's true. I mean, that's why we do it, period.
Yeah, because we want our animals to have long, happy, healthy lives.
Absolutely.
And I guess that segues, we've already talked about it some, but segues again into heartworms and heartworm medicine, because that is very common, is it not?
Very, gosh, too common. So what a lot of people don't realize with heartworm disease is it is spread by mosquitoes, okay? And I try, at least clients that have come to me, I will preach to them day in and day out about heartworm disease, but it's spread through mosquitoes. That doesn't mean that every mosquito flying around South Louisiana has heartworms. That's not true. Also, it cannot bite a dog who has heartworms and immediately cross the fence and come and bite your dog and give your dog heartworms. It has to live in that mosquito for about 2 weeks. The problem is, we don't know which one of those mosquitoes has it, which one doesn't. We don't know how often our dogs or cats are getting bitten by these mosquitoes. Again, if they're once those initial vaccines are done, or your annual vaccines are done, what's the next most important thing to do on your dog or cat for that matter? And I'll touch on that in a second. Heartworm disease, hands down. I can't stress that enough. I see heartworm disease dogs almost daily in my club, almost daily. And it's preventable, period. I mean, it's as easy, it's black and white. If you give a preventative every month, or in some cases every 6 months with ProHeart, you can prevent heartworms in your pets. Most people don't realize how common it is. Heartworms, I mean, but it is absolutely a preventable disease if you dose it properly and with the right weight distribution or weight size, and you do it monthly. It's a preventable disease.
So is that 100%. One of those, because of the dosage, that you need to get through your vet, or because I know there's some over-the-counter heartworm medicines?
Well, you shouldn't. There are a lot of the big companies now, for example, Bayer, has Advantage, all the different Advantage line of products is available over the counter. Some of your frontline flea products. The key word there is flea. Most of those guys are flea products, and they have gone OTC with a lot of those. Heartworm preventatives are still veterinary exclusive. They have to be through prescription of a licensed veterinarian, period. Now, you may be able to order them on pet meds and other online sites like that, but your veterinarian still has to sign off on those prescriptions. They have to. Yeah, clop that part out.
Lost your word, huh?
Yeah. What was I going to tell you about it? The different products. So I had alluded earlier about cats.
Yeah.
That's the other thing that I wanted to make. Cats don't get heartworms as readily as dogs. The studies that I remember being taught about and will occasionally read about in our journals, if you, for example, took 100 dogs and you gave them you injected heartworms into 100 dogs, you're going to have heartworms in 100 dogs.
Oh, it's 100%?
It's just about 100. Like if you're giving them a heartworm larval stage or infective stage, just about across the board, they're going to get, if they're not on preventative, of course, they're going to get it. You take that same 100 cats and you give them 100, you give them all heartworms, you're probably going to have about 30 or so % of those cats still have active heartworms, and even less, like I think a tenth of those are going to actually bring it full circle to like where they'll actually get full-blown adult heartworms. Okay, they're meaning 30% might get it and have it for a little while, but then their immune system is going to continue working on those heartworms and eventually clear their system of it.
So only about 10% of cats.
So probably probably somewhere closer along the lines of 10%. The difference being, a lot of people don't have their cats on heartworm preventative because they didn't know it was even an issue, or B, I've had cats all my life, they never got heartworms. That's fine. But the problem is with cats, 1 or 2 heartworms and you may not have a cat anymore. It is literally a different animal altogether. Not a cat, I mean heartworm disease in cats is a different thing altogether. Dogs can easily, depending on the size of the dog, tolerate anywhere from 10 to 20 to perhaps even more than that heartworms, and you wouldn't even know it without a blood test. 1 or 2 heartworms in a cat, and as I said, you'll have a cat that's either severely ill or deceased.
So they're much more sensitive to
much
them
more
if
sensitive.
they get
Much more sensitive. Yeah, and there's no really approved treatment for cats either. There's preventatives, but if they do contract heartworms, there's really not the same treatment options available for a cat that we have at our disposal for dogs.
But the treatment options for dogs are rather harsh.
Yeah, the drug, it's safer now.
Okay.
Certainly in my lifetime.
You see changes?
Yeah, big changes,
Good.
big changes. When I was a boy, we used to have to give daily heartworm pills. There was something called Filaribits, and it was something that you give every day. If you skipped a day or a couple of days in succession, you had to get the dog tested before you could put him back on it. Nowadays, we use monthly preventatives that have come a long, long way. I would argue that the treatment for adult heartworms has come arguably even further. It used to be what we would give was a drug called caparcylate, is I think the drug name, and it was an arsenic derivative.
That's the one I was familiar with.
That's still what a lot of people associate with heartworm treatment, and for good reason. It was scary.
Yeah.
You would probably lose just as many dogs to the treatment as you would have from the heartworms if you'd have left them untreated. So it was a very, it was a crapshoot whenever you treated those dogs for heartworms. Now, we use a drug called imidacide. The drug name is called melarsamine. It's a much safer product. It's a much easier to administer product. The only flaw that I would say with melarsamine is the dogs don't act differently at all. Used to be with, and the reason that's a bad thing is because they don't regulate their activity at all. Used to be with caparcylate, and don't get me wrong, I don't like it. I would choose imidacide every day of the week. But with caparcylate, you used to be able to give it, and the dogs, they were sick. They didn't want to do anything. They would limit their own activity because they felt that bad after treatment. That's not a good thing, but it was reality. Now with this imidacide or melarsamine, they are not affected virtually at all. I don't want to say at all because it's not true in every single case, but they don't feel clinically ill like they used to with the other stronger drugs. Is that a bad thing? Only in the sense they don't limit their own activity. So it's 100% up to the owner to say, nope, I don't care how good you feel, you have to stay in a kennel, you have to stay on a leash, what have you. And the difficulty with it is they have to stay confined for a period of minimum 6 weeks, depending on the way they're treated, perhaps up to 10 weeks.
Okay.
Some people,
so that can be a challenge for some
Can
dogs.
be a challenge, yeah. And I'll tell people all the time, I say, look, if you cannot keep the dog quiet, don't feel guilt-tripped into treating your dog for heartworms. If you cannot keep them isolated and keep them quiet for that period of time, don't do it. We'll work on it with preventative. There's now antibiotics, specifically doxycycline or one of its close relatives, that you can use that help to, I guess, speed up the treatment and lessen the potential for side effects afterwards. Excuse me. And we can still do those things and not have to limit a dog's activity level. But once you start to give that big gun, that imidacide that's going to kill the adult worms, it's imperative that they are quiet for, like I said, between 6 and 10 weeks.
Yeah, which does sound pretty, pretty like, ideal.
Yeah, it's a good thing. It's some people that scoff at the time frame, I always remind them. I say, look, you're going to look back in a couple of years, and 6 weeks is a drop in the bucket.
It's gone. Yeah, it's gone like that.
Yep,
So
absolutely.
Absolutely. So do you find, like, for most pet owners, we hear this all the time, that people are more attached sometimes to their pets than they are to the people in their lives, and you must see, like, really strong attachments that people have to their pets.
Yeah, you do. It's hard to say which ones. In my experience, it's those people that have, like elderly people whose children maybe have grown and left the house, and now that is their companion. Perhaps those that have maybe lost a spouse or something through the years, and that companion is that's their buddy. You know, they do everything with this pet, cat or dog for that matter. So you do see those connections, certainly. And to me, that's only a good thing, because to have that kind of an affection and a relationship with an animal, they're going to do the best thing for it. You know?
I think it totally enriches the lives of all.
Absolutely,
but
of both parties.
That was my segue to that whole euthanasia issue, of course, because as we become so attached to our pets, or maybe we're not so attached, but regardless, euthanasia is a part of your veterinary business, and so how do you do that? How do you come to terms with that?
Yeah, it sounds strange to say it takes a lot of practice.
Well, I guess it does.
But it does. It does. The way I look at it is I don't have to do anything that I don't want to. Over 15 years, I've gotten a handful of calls from people that say, hey, I need you to come out and put my dog or cat down. I'm moving to a different apartment and they don't allow pets. Can you come put her down? And the answer is a very quick, well, you called the wrong person. You know, I'm not forced to, and I won't do things like that, because that's not the point. That's not the oath I swore when I became a veterinarian. That's not relieving animal suffering. You know, that's just removing an inconvenience from an owner, but there's just too many good options.
Yeah.
So that being said, you know, really with euthanasia, the way I look at it is this: you are allowing an animal to go with a little dignity, so they don't have to suffer until the very, very end, when probably the most common things that we see is animals with terminal conditions, not only cancer, but certainly cancer is high on that list. We see it pretty often. But anything, kidney disease, you know, sometimes some of the harder ones are just arthritis. You know, we see a lot of we see a lot of large breed dogs, myself included. I had a Labrador that was 13 and a half years old, who from about mid-back up was perfectly fine. His mentation, his drive, he was my dog. Everything about him was the same, but he just got so arthritic on the back end that his back legs wouldn't work anymore. You know, and I find those to personally be the most difficult, because yeah, he's suffering, and that's why we still do it. You know, we have to. But it's tough, because when you know that mentally he's normal, and he still has the heart and the desire, and he ate and he drank and he did everything else the same.
And he loved his daddy person.
He did.
You know.
Those are some of the most difficult. What changed for me was when I lost my own grandmother in, I think it was 2003. Excuse me. She had a terminal condition, a respiratory condition, but there was no cure for it. There was no medication that would make it go away or even get better, for that matter. And she probably spent the last 6 to 8 weeks of her life suffering. She was on oxygen and could barely breathe and could barely talk, and there was nothing we could do. We just had to watch. That is, for me, what changed my perspective on euthanasia, because when I saw my grandmother sitting there and I knew that there was nothing that anybody could really offer her to ease her suffering, I wouldn't have let a veterinary patient do that.
Yeah.
You know, we wouldn't have allowed it to get to that point. And that's not a bad thing. In fact, quite the opposite. I think it's a good thing that we can offer. It's a weird power for me personally, and I say power just because I grappled with that when I was a younger veterinarian.
Totally, yeah.
I hold in that syringe, life or death.
Yeah.
If I don't give it, they live. If I do give it, they die. You know, it's a very, very weird thing to have to deal with. But that case, that experience with me and a family member, for me, was what that made me realize that I'm not doing a bad thing. I'm not being mean. I'm not abusing a power that I have. I'm letting them go with a little pride, with a little dignity, so they don't have to suffer till the very end.
So
you know?
really, it really is about humanity.
Absolutely.
Our
I
own
wouldn't do it
humanity
any other way.
and loving our pets. Scott, we are just about out of time. We have just about a minute and a half left, but I want to mention very briefly that you actually do have a mobile unit, so that if people can't come to you, you can go to them. Mm-hmm. Is that right? Is that a new trend in veterinary medicine? I've heard about it
not.
before.
No, I'm kidding.
You're the only one in the world.
The only one in the entire world. We're booking appointments in Europe next week. No, so it's becoming that way. I think, like anything else, convenience is always of the utmost importance, and this, you know, society in general, if it's not convenient, they're shying away from it in some ways. But the benefit, like, we work out of a 24-foot mobile hospital. I have a surgery suite in the back. We have a digital scale. We have cages. We can do everything from dentistries to spay and neuters to vaccines to just about anything in between. The only thing that I can't do on the truck, I don't have x-ray equipment, and I don't have the ability to hospitalize patients. But that being said, just in the last 7 months, I opened a brand new facility in Scott on Apollo Road. So we do now have like a, 3,500 or so square foot hospital where we are a fully functioning hospital. So now we can offer x-rays and hospitalization and many other services that I couldn't do on the truck.
Okay, but it's good, especially for some who have trouble moving their animals, it's good to know that somebody will come to them.
Because literally, if we go that way, I mean, when I pull up in the driveway, there is a full functioning hospital in your driveway,
right,
literally.
So I don't have to try to put my cat in a pillowcase to get her into the car.
Excuse me, we see a lot of large pets and we see a lot of cats. We see a lot of cats.
Exactly.
Yeah, because nobody likes to put them in a carrier if they don't have to.
It's not easy. Scott, we're out of time. We didn't even get to talk about spay and neuter, so just briefly, spay and neuter.
Yes.
Scott, thank you so much
Thank you
for
very
coming.
much. It was my pleasure.
And thank you for watching The Extra Mile.